So when I started thinking about partnering with a DSO, I had been in practice as a solo practitioner for 22 years. And I had done it all by myself. But at the time, I'm a wife, I'm a mom of 4, and life was busy, life was full. And I found that the stress was just growing and growing and growing. I felt that I wanted to change, and I wanted to be the best wife and mom and dentist that I could be, and I didn't like the direction I was going just in regards to my health and my energy and who I was becoming with the amount of stress. So therefore I started looking at different options and seeing what was possible and seeing what was out there. The typical reputation, I think, of a DSO is that they come in and they clean house, whether it's the team, whether it's the culture, whether it's the doctor, whether it's the uniforms, whether it's the hours, whatever it may be, and that is something I wanted no part in. And so STAR has been the antithesis of that, where again, we keep doing what we're doing. STAR has helped us maintain our brand, our identity, our culture by really allowing us to continue doing it our way. Clinical autonomy, I get to do things my way still, which I really like. A lot of DSOs, I don't think that is the situation. And with STAR, clinically and in the practice, things haven't changed that much. About a month or 2 after partnership, and I, for again, 22 years, have paid all the bills and dealt with all the headaches, and when the hot water heater breaks or an employee doesn't show up. And I remember saying to myself, I'm not doing payroll right now, and that feels really good. Someone else is taking care of that. I'm not having to pay the credit card bill, or I have a question about marketing. I have a team that's supporting me that can help decide whether this is a wise choice to move forward with or not. I partnered with STAR not because I don't know how to run a really nice business, but I wanted to no longer do it alone. I wanted the support, I wanted help. A big part of my partnering with STAR was focused around finances. Both my husband and myself paid for our own undergraduate and our own dental school. So we were in quite a bit of debt, but it was good debt, but we were still in debt. Purchased the practice on our own, made improvements over the years, which we acquired more debt. And so we found ourselves in quite a bit of debt, and I simply couldn't crawl out of it. By partnering with STAR, I've relieved that debt and been able to focus again on patients and not have to have the financial worries that lead to sleepless nights. Partnering with STAR and truly being a partner, I find is important. As I'm now a partner with STAR, I want to help make STAR better. Leaving a legacy is very important to me. Again, because I have grown this practice on relationships, on longevity, on loyalty, whether it be the patients or whether it be the teammates. And we have a lot of fun. The ladies I work with are the best in the business, and it shows, and the patients feel it, and that's important to me.